Are there any cases that you can do both with OSSIX Plus, Volumax, and bone that might be cases that you otherwise could not do?
With the Volumax, it's really changed the way we're treating the small dehiscence or fenestration type defects, or even areas of bone that is present but extremely thin, where normally we would use a particulate. We'd be concerned about graft containment with a membrane and manipulation, where we can place the Volumax sometimes in double layers directly over exposed implant threads and predictably see that site repair itself with new bone, since the Volumax actually is a bone graft and not a membrane.
So you don't need additional particulate bone or allograft materials with it, so you would just use the Volumax?
Right. In a small dehiscence type of defect, you typically don't need to place a particulate because the Volumax is serving as a bone graft, and you can lay it directly over where you want the bone to grow, and you don't have the issues of graft migration or movement of any of the particulate underneath your soft tissue. But the Volumax is very stable. I will use a punch, place it over the implant, and then gently tighten the healing abutment around it and just suture around the Volumax. And you'll see over time the soft tissue volume increases, and we're starting to see on cone beam regeneration of that lost facial plate of bone.
Interesting that it always seems like we're in such a hurry. That I keep hearing people say, extraction site, you can go back in 2 months, but 4 months, is that a minimum for you?
Most of the time, 4 months is my time frame. Maybe in a very narrow site, it would be less, but to be honest, in most of those sites, the implant's going in at the time of extraction. Once I think the patient is resigned that the implant is not going in at the time the tooth is coming out, whether you're waiting 8 weeks or 16 weeks, in the big picture, I don't think is really that critical or important when we have materials such as the Volumax and the OSSIX Plus that we know are going to predictably regenerate the patient's own bone and give them years of stability for both aesthetics and health of the implants. I don't see what cutting 8 weeks off the treatment time is doing in the big picture.
How about in a grafted site with the OSSIX materials? Is the time to re-enter to the implant, if it's not an immediate placement, is that the same protocol, or does that change at all?
Typically not. I mean, if we're going to place a material like the OSSIX Volumax over a dehiscence, but the majority of the implant is seated in native bone and we have the stability that we're looking for, it doesn't really change the loading protocols. Those loading protocols are typically 10 to 12 weeks from time of implant surgery until the restorative treatment begins. And I feel very confident that even at 3 months, when the Volumax is not in an ossified state or the bone hasn't replaced it yet, that we know over time this will happen. And so I don't slow down my restorative dentist from getting started within the normal 10 to 12 week time frame.
And you know how long it takes for the Volumax to ossify?
It's about a 6-month period. We've had some radiographs or cone beams taken earlier, and we see some radio density, but at 6 months we really start to see that bone-like appearance of the hard tissue on the cross-sectional images. And we know from the Volumax animal studies that by 6 months we have bone regenerated.
How about also using OSSIX bone for a conservative osteotome sinus procedure for a single or double tooth replacement?
That has become one of the biggest shifts for me. Someone who performs a lot of crestal sinus lifts at time of implant placement, I feel so much more comfortable using a material like OSSIX bone, which is collagen, will not move, will not migrate. We never really know if we have any small perforations of the Schneiderian membrane, and with the particulate, it's always a concern there could be graft migration. This material, one being collagen, is hemostatic, so we don't see a lot of bleeding once the material is in place. Two, we know that that's the kind of material, normally a collagen, that we would use to repair a sinus perforation. So it's serving that purpose as well as serving as a bone graft. And now we're getting some of these initial cases brought home restoratively, and we can trace from time of surgery till time of restoration, which is typically in that 4 to 6 month period. Beautiful calcification on the radiographs, suggestion that this basically radiolucent graft is turning into the patient's bone.
If you were talking to somebody who uses resorbable membranes and they'd like to try using OSSIX, is there a type of case that you would say, your first case, try this?
Any case where a membrane is going to be used and it can be laid nicely over your graft, adapted under your flaps, there's not a lot of manipulation, you're not doing a lot of trimming, certainly you're not using fixation, tacks or screws, but just a nice, easy case where you're laying the membrane. For me, for almost 20 years now, OSSIX and now OSSIX Plus has been my membrane over lateral window sinus lifts. It is the easiest material to use, and when you go back in, you have a white, chalky new window of bone over your osteotomy basically every time.
And do you still suture the membrane in place?
You basically don't want to suture the OSSIX membrane. What you do, and what I do, and what I know others involved in its development do, is a modified horizontal mattress suture that just will hold the membrane from migrating. But typically, once this membrane is hydrated in saline and then placed in a live field where there's blood to absorb, it doesn't do a lot of moving anyway.
Obviously, it sounds like this has had an impact in your grafting procedures.
I've been using OSSIX in my practice since 2002, I believe. It is my go-to membrane. It is what I would say to clinicians thinking about this who maybe were trained like myself with EPTFE, non-resorbable membranes, and still consider that, or did consider that, the gold standard. That I would say if you want a resorbable membrane in sites that you absolutely have to grow bone, this is really the gold standard.
Does it impact the thickness of soft tissue, or do you still do combined membranes if you want to increase the amount of connective tissue or keratinized tissue?
The OSSIX Plus membrane does not affect the soft tissue thickness. Now the Volumax we're starting to see in procedures. I'm starting to use it in a procedure I call VoluShield, where we're placing it on the internal aspect of an immediate implant site and leaving it above that facial bone wall to the height of the soft tissue margin, that it seems like the soft tissue thickness is increasing as well. But this is very early on and we're still looking at this. But I think the Volumax has tremendous potential, not only to increase hard tissue volume, but soft tissue volume.